With that many cases and that much loss, as you can expect, we have a number of red counties that here being Thursday, at the end of Thursday, we'll set the counties for following our red zone recommendations, recommendations for schools, and recommendations for long-term care. Let's show the map first, James. Folks, we're down to just 2 yellow counties. And today we have 80 red counties. That means virtually the entire state is seeing a significant surge. But it means for these red counties, it's dangerous out there. It's dangerous to you personally. It's dangerous to those around you. It's dangerous to especially those most at risk from this virus. So what does it mean to be in a red zone? Can you put up the recommendations? It means that first, we have school recommendations that you learn virtually for this next week starting on Monday. Second, it means that long-term care visitation is going to be further restricted because it's a dangerous time. We want to keep that virus out. Third, it means we're asking every business in every red zone to allow as many people to work from home as humanly possible. It's going to be needed both so that they can support their families, but you're also risking an outbreak in your facility or your business during this time. Government, and that is local and state. We're asking you to move to fully virtual unless there is something that is a necessary essential service that has to be provided in person. Public events, private events, postpone anything that you can. Don't have any gatherings. Don't have people over if you are in a red county for this next week. Again, we see more spread at gatherings like that and family gatherings than anywhere else. And right now it is that elevated in your community. And wear a mask at all times when you are out in public, please. It is that dangerous right now. Following these recommendations gives the best chance for your community to get out of the red, but also for you to protect your health and the health of your family at home. So if you are in a red county, stay home as much as possible this next week. Support your local businesses by takeout and carry out. Please try to support them the amount that you otherwise would. But if you are in any of these 80 counties this next week, we need a lot of work to get cases down. You can read them there on the screen, given that they're 80. I'm not going to read through them out loud, but this ought to set next week. And let me say, if every community on here can and will do this, with 80 communities doing this through the next week, and many of them having just done it through this week, we can have a very significant and serious impact on slowing the spread of the virus. This is about 2/3 of the state. This is an opportunity. This is an opportunity to really slow the spread of the virus, but we need your help. Again, it's asking a lot for a lot of communities, but it's not asking a lot in the middle of a global health pandemic that's taken over 1,500 lives, and right now at the escalation will take over 1,500 more. If we can't do this, if we don't follow the recommendations and the guidance, we know what'll work. We just need everybody willing to do it. The other thing we need in red counties and other counties is for people to continue to get tested. If you're in a red county that's listed right there and you've been out, go get tested. It is that widespread in our communities where we need you to do it. If you're in the Louisville area that is in many ways hit the hardest, you have a ton of different options, including surge testing that the federal government is helping us with at the Kentucky Expo Center. That is funded by the federal government. We want you to take advantage of it. Lexington starts November the 16th. Again, this is, we pay some administrative costs, but basically free to the state because the federal government sees how much virus we have. There are very short lines in this one in Louisville. You can sign up probably even for tomorrow. We're averaging about 200 tests a day. We can do more. So again, go to that website. and it's all on kycovid19.ky.gov, 9 to 5, Monday through Friday at these sites. They can test 200 to 300 people a day, so we can do more. Other sites that are being supported by the state: Purchase District Health Department, providing testing in McCracken, Ballard, Carlisle, Hickman, and Fulton counties. Please take advantage of it. A lot of red counties in that area. Ashland Boyd Health Department, Boyd County is red this week, is providing testing opportunities for Boyd, Greenup, Carter, and Lawrence County. They'll be testing in Lee, Wolf, and Owsley through the Kentucky River Health Department. Kentuckians in Hardin, Meade, LaRue, Nelson, Marion, Washington, Breckenridge, Grayson. Oh, Rachel, I'm doing that really fast. My apologies. And other counties in the region can get tested through the Lincoln Trail Health Department. In Northern Kentucky, Gravity Diagnostics, St. Elizabeth's Physicians, and St. Elizabeth Healthcare are partnering to provide testing sites at Erlanger and Alexandria. And there is more testing in Louisville through Norton Healthcare and U of L Health. Please, especially in these hard-hit counties, go get tested. And we'll talk about this in a little bit. Remember, if you are called by a contact tracer, you have to pick up the phone. We're seeing a drop-off in people being willing to pick up and to follow the instructions. And that means we're seeing more people that would rather knowingly spread this virus than stop it. And the inconvenience of being in quarantine, I've gone through it. I've done it. We need everybody else to do it too. The potential ramifications of not doing it are unacceptable. And know somebody very well that was almost 10 days into a 14-day quarantine with her husband, and her husband just tested positive. That's how important it is to follow all of those guidelines.